Well, a new emergency department at Johnson Memorial Health in Franklin is seeing its first patients. Johnson County is the third fastest growing county in the state. So hospital leaders say the new ER was desperately needed to keep pace with community needs. Business of Health reporter Kylie Veleta has more. Kylie.
Thank you, Gary. While the ER is a major piece of the $42 million investment, the project also includes new areas for outpatient services, physical therapy, and orthopedics. It's the largest expansion in the hospital's history, and the ER certainly had an interesting path to opening, which included a scramble at the 11th hour to switch the ER to a temporary COVID-19 isolation unit. Joining me now to tell us more is Johnson Memorial's President and Chief Executive Officer, Dr. David Dunkle. Dr. Dunkle, thank you for being on the show today.
Thanks for having me. I appreciate it.
Sure. So Johnson Memorial, it's the only full-service hospital in Johnson County, and a major goal for this project, which really has reshaped the entire campus, is to keep care local. Can you talk a little bit about that?
Sure. We did a study back in 2016 with the consultants who really talked about how much the county was growing, not just all of Johnson County, but also Franklin. Franklin was building homes, building a lot of infrastructure, and basically they said the hospital facilities weren't big enough to keep up with the population growth. Our emergency room was too small, our outpatient areas also need to be expanded, so that's when we decided that in order to better meet the needs of the community, we had to expand, and we decided to build a new emergency department, expand capacity from 15 to 26 rooms, add some decontamination areas, increase the ability of our trauma rooms to better care for seriously injured patients by installing things like special lifts. We really did not want people to leave our area and to have confidence that we could meet all of their needs.
Okay, so let's talk about the new ER, and wow, what a path it had to opening. COVID comes down the pipe. Talk about how your staff really had to put their pedal to the metal and open it, but not as an ER, as a COVID isolation unit. Can you take us back to that time?
Sure. You hate to say you got lucky at all during this COVID period, but we were supposed to open in January of this year, the ER, but there were some delays, which again, a project that size isn't unprecedented. But as COVID began to hit in early March, we were still quite some time from being done with the complete project. And we originally were going to finish the lab area first, then medical imaging, and then the ER. But we kind of talked about the fact that if we diverted all of our resources just to the emergency department, could we get this area up and running, but not as an emergency department, but as a COVID unit? And we did that. I can't tell you how proud I was of my hospital, of my organization. It was all departments coming together, from IT to respiratory therapy, the doctors, the nurses, construction crews, all getting that area ready, that really enabled us to take care of up to 24, 25 COVID patients at one time in an isolated area away from the rest of the hospital with a different air handling system. So it put people at ease. If you remember back in March, we didn't know as much about COVID as we did now, and people were afraid.
Yeah, you mentioned it was really almost like a morale boost for your medical staff, who, like you said, it was very scary at the time.
Yeah, they were. I said it to my board members, you could feel the difference on Monday. We opened the unit on a Friday, and walking through the hospital halls on Monday, there were a lot of smiling faces. Not just that I think people were proud of what we'd come together to accomplish, but also the fact that the rest of the hospital truly felt safe knowing those COVID patients were being taken care of in their own isolated area.
Right, okay, let's talk about this partnership with the Boone County Emergency Medicine to staff and manage the ER. Why did the hospital decide to go that route?
Well, I'll be honest, there's several reasons. A lot of hospitals our size do outsource emergency services. We had done this for many years, and we decided to bring it in-house, and it just didn't work out that well. As people know, it's more than just the medicine care. There's the billing and the coding that is so much a part of hospital reimbursement. And to be honest, we just didn't have the internal knowledge needed to really master that. And luckily, the Boone County Emergency Medicine Medical Director, a fellow physician MBA, Dr. Tom Henniff, reached out to me, and we were very like-minded. And you know, as I did more research into their group, nationally renowned for their door-to-doctor time, multiple awards for customer satisfaction, it really was kind of a no-brainer. I wanted to be with a group of all board-certified emergency medicine physicians, a group that knew how to do emergency medicine, because again, I had this great new building, and I thought, it's more than just a building, it's the people inside. I want to be able to deliver the highest care quality of care I could to our community.
So this is just a few seconds left, but you talked a little bit off camera how margins are slim for hospitals right now, especially those the size of Johnson Memorial. How do you balance that with also needing to reinvest in yourself?
It's difficult, but again, if you're not growing, you're dying, as they say. So we've been very fiscally responsible for many years. Again, we saved a lot of money before building this project. We didn't rely on tax dollars. So with margins being small, we do have to look at what's the best things we can invest in. In this case, it was a new emergency department, outpatient services. But there's some things we can offer. We don't have a cath lab. We don't have radiation oncology on campus. I hope to have those someday. But again, it's tough. It's tough out there. I think the average margin for hospitals right now in Indiana is over -8%.
Yeah, it is a tough time. Thank you for being on the show today. Congratulations on the expansion. I live nearby and it looks fantastic. So thanks for being on the show.
Thank you so much.
Gary, back to you.